Hello, 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 everyone, and welcome to another edition of Ask Dr. Dansinger with Dr. Michael Dansinger, world-renowned diabetes reversal expert. He is at youtube.com/, the @ sign Michael Dansinger MD. And you can also go to his website, diabetesreversalpartners.com, for more information. He's in Massachusetts, he's in New Hampshire, he is in Florida, and he is covered by Medicare. And he has worked with several of our patients with the Global PAD Association, and they have rave reviews. We even saw one person's A1C significantly drop in a matter of just a couple of months of working with him. So he has a lot of great tips and tricks and can work with you on your timeline and with your presentation of disease. He personalizes everything for you. Today, we are going to be focusing, though, on just protein. Protein is such an important part of the diet. And so many people have a lot of trouble making sure that they get enough protein in their diet, especially when they have wounds that won't heal. That is really important. But also with diabetes, it is a big part of helping you to reduce those crazy carbs and all that sugar. So, Dr. Danzinger, when I said this is a topic I want to do, you're like, oh my gosh, this is perfect. Absolutely fantastic. Why is that? Why is protein such a great topic for you and near and dear to your heart?
Yeah, thanks, Kim. Thanks for the opportunity. Thanks, everyone, for participating today. Great topic, protein. So protein is one of the three major macronutrients. There's carbs, fats, and protein. And many people have questions about protein. Many people love to eat protein. Some people don't get enough. Some people get too much. There's many different sources of protein. So let's dive in.
Yeah, I think there's some get too much, some get too little. Why don't we just first start with what does it mean to get too much protein? Are there symptoms of it, or do we just know somehow that we shouldn't be eating that much and we do?
So almost everybody is getting the right amount of a decent amount of protein, not too much and not too little. Our bodies our appetites kind of take care of that for us. And so the human body can do well with a very wide range of protein. And so you want at least, 10 to 15% of your calories to come from protein, and you don't want more than, let's say, half of your calories to come from protein. Very few people get more than a third of their calories from protein, and it's kind of if you're on. So the kidneys are responsible for handling protein, and there's nitrogen in protein, and the body needs to get rid of the extra nitrogen, and that's what one of the many functions of the kidneys. And the kidneys turn extra nitrogen into urea, which goes out into the urine. Now, people with normal kidneys can handle pretty much any amount of protein you want to eat. People with kidney disease need to be careful not to have too much protein, because if the kidneys are sick, then eating a lot of protein puts an extra burden on those abnormal kidneys, and it can make things add insult to injury, so to speak. And so if you have kidney disease, then you need to work with a nutrition expert, a dietitian, or a nutritionist to make sure that you're not eating too much or too little protein. But for the rest of people, then um, you're not damaging your kidneys by eating protein.
So Charles, who's watching, is asking, well, can too much protein cause chronic kidney disease?
No, not if your kidneys are normal. Eating generous amounts of protein, it won't harm your kidneys if they're normal to begin with. But kidneys are damaged by high blood pressure or high blood sugar, or sometimes by obesity or other things that can, promote heart disease, can also promote kidney disease. And so doctors test for kidney damage and kidney disease using blood and urine tests. And so no, normal, in normal kidneys, you're not going to damage it by eating protein.
So, for someone who does have chronic kidney disease, and I know it's likely different depending on the presentation of disease, and it may also depend on whether you're on the spectrum of, chronic kidney disease, 1, 2, 3, or 4 stages up to ESRD, which is end stage renal disease. But do you have any sort of guidance for those people who have diabetes and chronic kidney disease in making sure that they don't overeat protein?
Great question. So it does need to be personalized. And, if you have kidney disease, don't rely on me or the internet to get your answers. But, you want the right amount of protein. And so having protein in, small to moderate amounts twice a day is probably a pretty good rule of thumb. You want, for if you have kidney disease, you might want to be eating portions of protein that are like 3 ounces, for example, on 2 occasions per day might be a reasonable amount. I'm not a nephrologist. This is outside my area of expertise, but you need some protein, and there's many sources of protein to choose from out there. So, um, the body needs at least, around, 75 grams of protein per day. That's not very hard for most people to get.
And so, if you do have chronic kidney disease and you are limiting your protein, are you at a disadvantage if your body is not getting, um, protein? Are there any side effects to not being able to eat protein at a level a normal person would?
So, you know, our bodies rely on dietary protein for a wide range of functions, like our immune system, keeping our muscles and bones healthy, keeping our organs healthy, keeping our brains healthy. So protein does, it serves us in many different ways to keep our bodies healthy. Wound healing and immunity are the most important and can suffer if we're not getting enough protein. Most people have no problems really getting enough protein for those functions if even if they have kidney disease. But people with kidney disease, if they are not getting enough protein, are at risk for infections and delayed wound healing.
Let's talk about protein and wound healing. How is it that protein actually helps with wound healing? Why does it help with wound healing?
Yeah, when you have a wound that you're trying to heal, um, you, your body is trying to use protein to heal the wound, both to build new tissue and to defend itself via the immune system. And so, some studies have shown that collagen protein supplements can help speed wound healing along. But most of the protein needs are best met by just getting protein from a variety of sources. But yes, when you're trying to heal a wound, you definitely want to be sure that you're having good quality protein in your diet.
And why is protein and making sure you get enough protein especially important for diabetics?
So with diabetes, especially type 2 diabetes, most people are trying to lose weight. They're trying to reduce their calories so that they can reduce their glucose or hemoglobin A1C and, you know, any excess insulin that their body is making due to insulin resistance. And so, you know, in type 2 diabetes, when we're looking for weight loss, dietary protein is usually our friend. And so our enemy is the combination of, highly refined starch and sugar and animal fat. And lean proteins can help us along with vegetables and moderate amounts of fruit. So I typically advise most of my patients to eat generous amounts of lean protein. So lean protein is very good for satiety. Lean protein, I'll give an example. Chicken breast is a good example of a lean protein. That kind of protein is especially good for raising satiety hormones, including GLP-1 is a satiety hormone. It's good for helping to decrease hunger hormones like ghrelin. And so protein has the most favorable hormonal effects um, for satiety. It also slows digestion. And so if you're eating, starch and sugar, having protein with it helps delay the rise in blood sugar that you would have. Also, eating protein burns a little bit more calories just because of the effort of digesting protein is more than the effort of digesting carbs and fat. And so the thermic effect of food is greatest with protein. And also, protein doesn't spike blood sugar in the same way that carbs do. And so, for all those reasons, I typically want to push the protein higher in most of my patients who have type 2 diabetes and use it as the main way to help them eat less sugar and starch.
And we have Beth, who's in our live studio audience, and she's mentioning that being a type 1 diabetic, she eats a lot of protein when she doesn't feel like eating carbs. She gets tired of carbs and high sugars, but good. You shouldn't be eating a lot of carbs and high sugars, I would imagine anyway. So this is probably music to your ears. You actually probably want these patients to go for the protein first before they go after the carbs and the sugar.
Yeah, what I'm looking for in most cases is a wide range of vegetables, especially non-starchy vegetables, a moderate amount of fruit, and plenty of lean protein. And so there's both vegetarian and non-vegetarian sources of protein, and I think both are important and valuable. Non-vegetarian, well, vegetarian protein sources that I encourage include um, legumes, beans and lentils, for example, soybeans, soy protein, I think is good in general, tofu, tempeh, those are all good protein sources. Nuts have some protein. Um, Greens and mushrooms have, a little bit of protein in there. And then there's eggs and dairy. So if you're vegan, you wouldn't eat those, but if you're vegetarian, you might have eggs and dairy as important vegetarian protein sources.
But if you are vegan, how do you ensure that you're getting enough protein? I know, for example, artichokes are higher in protein than a lot of vegetables.
Yeah, I think most vegans are getting enough protein without putting too much effort into it. If vegans are eating, um, legumes, if they're eating greens and mushrooms and whole grains, they're likely to be getting enough protein. They can add a vegan protein supplement to help push the protein much higher. And so there's plenty of, vegan soy or vegan protein powders out there that might be made of pea protein or soy protein or rice protein. So those are out there. And um, tofu and other similar foods, I think are all a valuable part of a vegan eating strategy that helps to get enough protein.
And Beth comes back. She says, "Oh boy, I'm in trouble." She does do turkey, cheese, eggs, and she does say that she eats lots and lots of vegetables.
Yeah.
So that's really good.
Yes, I agree.
So what about those who are eating meat? You were mentioning, especially if you have chronic kidney disease, maybe just 3 ounces of meat twice a day for those meals. But of course, always make sure you're checking with your own dietitian who knows your situation best and is monitoring your bloods as well as other labs. But when it comes to a normal, just diabetic, what would you suggest in terms of the amount of protein per meal and just throughout the day with snacks as well? You mentioned, I think, 75, was it grams of protein?
So, the body, most bodies need, at least, you know, 60, 70, 80 grams of protein. So that's on the low end.
And what does that look like?
Eating sort of the least amount of protein possible. So it looks like probably a vegan diet where you would get your protein from, um, a combination of modest protein sources. In a non-vegan, in a meat eater, they're getting, usually 20 to 25% of their calories from protein. At a maximum, I would not typically recommend more than 1 gram per pound of body weight. If you weigh 200 pounds, I probably wouldn't eat more than 200 grams of protein. That's very much higher than, like the 75 grams that your body absolutely needs. So most people can benefit by eating more than their, minimum requirement. So what it looks like is typically, at least 2 meals that include a significant protein source. And it can be beans or legumes. It could be eggs or low-fat dairy. It could be fish or seafood. It could be poultry, especially poultry breast. It could be lean red meat. So all of those. And portion wise, you can use the palm rule. If you hold out your palm and ignore your fingers, that is, a serve a average serving of protein. And so the bigger you are, the bigger your palm is. Some people have like a 4-ounce palm. Kim, you have a 4-ounce palm if
Yes,
you ignore the fingers and
compared to
look
my
at your
dad, yes.
at your thickness and diameter of your palm. Mine is probably more like 6 ounces. Then some basketball players might have a 9-ounce palm, but the bigger you are, the more protein I think you're likely to eat, and you can use that palm method. I would, you can eat a little bit more than that if it's fish, and maybe a little less than that if it's red meat.
And so buying a 16-ounce grass-fed, grass-finished steak is probably a waste of money because it's more protein, especially for me, that's 4 times more protein than I need in a single
Yeah,
sitting.
you wouldn't eat a pound of steak in a meal, but if you
Well,
cut
they
that
serve
up
it at
into,
restaurants. My dad's like, "Oh, wow, that's great. It's 16 ounces of
yeah,
steak." And
save the
I'm like, "Dad, I
leftovers.
think you're wasting." Yes, I think you're wasting your money. But if you do end
Yeah,
up getting something like that, what I always tell him to do is to end up just portioning it at the restaurant and go ahead and get your to-go box before you even start. So cut that portion that you need for that meal and then take the rest home.
sure. When I was studying nutrition, 25 years ago, and looking at all the research and trying to really grasp, I was learning about the principles of nutrition and looking at the research. I wanted to see for myself what's going on with nutrition. And when I looked at studies that replaced carbohydrate with protein, just swapping them, what it was very striking, the improvement in blood sugar levels after meals. And so in these research studies that were published, I would see that after a meal, especially a starchy or sugary meal, the blood sugar would spike, within an hour after eating, say, rice, for example, and then it would come down, like a roller coaster, and that would trigger that that falling blood sugar would trigger hunger and cause people to want to eat again quickly. And if they ate lean protein, that blood sugar spike was absent, and they were happy to go longer between their next meal. And it occurred to me that this is a very important strategy to help people who have blood sugar issues. And I really, leveraged that a lot when I started, working with people who are trying to reverse their type 2 diabetes. And so a lot of it is trying to replace sugar and starch with
Yeah.
lean protein or vegetables, or in some cases whole grains, but giving people strategies to decrease their animal fat as well as their sugar and starch.
It's interesting. When I had a trainer long ago, she gave me a book that cost me $1 on Amazon. I can't remember what it was called. And then top theory in the book was that you need to balance out every single piece of fruit or sugar or carb or whatever you eat that has the potential to be high glycemic with protein. So my stacks during the day that I would prepare for ahead of time included having a handful of walnuts and an apple, or an egg with paired with an orange, that kind of thing. Is there anything clinically to support that theory?
So yes, it does work when if you're going to eat something, you know, carbohydrate, if you pair it with protein or with fat,
Mhm.
then like nuts are mostly fat. They have a little protein in them, but that that blunts the rise in the peak in the blood sugar that you would otherwise get if you skip the protein. On the other hand, though, we have lives to live, and sometimes, sometimes it can be laborious to, have too many rules for your
Yeah.
eating. So, in theory, it makes a lot of sense to, if you're going to have carbs, include enough protein in there. In practice, though, it can be very, very tricky. And so, if you want to have a piece of fruit that's just a piece of fruit, then it's probably not that big of a deal. Fruit is good for weight loss and it can raise blood sugar, but as long as you keep the portions okay, and as long as it's a snack and part of a balanced diet, you really don't have to have protein every time you have fruit. It's it in theory it makes sense. In practice, it just might be too much.
And so I had gotten in a couple of questions earlier today, knowing that you were going to be on, that are a little off topic, and they're always welcome. So, anyone in the studio audience or online is always welcome to ask Dr. Dansinger anything about diabetes. And one of them in particular was in regards to a brand new study. And if you'd heard of the new STRIDE study for the GLP-1 drugs, um, the Wegovy, the Ozempic, and one other one were tested in PAD patients, and they found that there was improved walking distance with reduced claudication. And they didn't really talk much about the why. We're going to get ready to interview one of the doctors on this study later this
Oh,
week. You may want to
great.
join us on that. But this patient Patrick was just asking if you knew of any particular, had heard of any stories along those lines from any of your patients that have been on any of these drugs that have improved their walking distance or improved their ability to do more exercise being on them.
Oh, great question. Yeah, I saw the study came out, but I look forward to reading the details. And no, I have not had enough experience with patients who have PAD and who are on the GLP-1 drugs to know, to have any anecdotes about people, improving their walking distance, but it's an exciting finding and it's not that surprising. So, weight loss is good for so many different health conditions, and I suspect that's the main way that it's leading to improvements in decreased claudication, but I'll have to read the study.
And this one's a little more serious. I'm not sure if you can even address this at all, but Kelly is really concerned because she has been a type 1 diabetic. Her pancreas was injured by some medications that she was on long ago. And she was just told that the insulin is no longer working for her. She has somehow become resistant to the injections. And she wondered, is it possible to be able to improve her situation or maintain with diet at this point, or if you'd have patients in her situation and what the options might be?
Oh, I have not experienced this sort of thing with patients, to be honest. So it's outside of my expertise. When, in type 1 diabetes, the pancreas just isn't making insulin. So you need the injections. And when there's insulin resistance, then the dose of the insulin needs to go up, and you want to identify the underlying cause of the insulin resistance. And in the old days, there used to be problems with antibodies against insulin, but that's hardly ever a problem with current insulin preparations. Um, we need an expert endocrinologist with expertise in this sort of thing. But if
Yeah.
the main culprit is insulin resistance, then understanding the underlying reason for that is key.
Yeah, and just she was just asking if there was anything diet wise. I mean, I would imagine for someone like her, it'd be more um, important than ever to make sure that you're not tackling those carbs and the sugars and things like that, making sure probably you really focus on those proteins and vegetables.
Yes, and so a low glycemic diet, which would include a wide range of lean proteins and low glycemic, carbohydrates and healthy fats would be the treatment of dietary strategy of choice for pretty much everything.
And Douglas is asking about hard-boiled eggs. How many of those can you eat at once? I was told that at one sitting when I paired it with my blueberries that I should have two egg whites and one full egg with the yolk.
So
What do you think?
if you ask different nutrition experts about eggs, you might get different answers. And so if you get 10, nutrition experts, you might get 10 different viewpoints on eggs. So so 75% of the calories of an egg are in the yolk. And the white is pure protein, and the yolk has fat and some of the nutrition, the vitamins are in the yolk. And so when weight loss is the main goal, then egg whites are your friend, and egg yolks have the calories. And so you can eat four egg whites for the same as one egg yolk. And so just if you're trying to fill up, egg whites are your friends. Now yolks have saturated fat and cholesterol. The quality of the fat in the yolk depends on what the chicken's been eating. And that was a whole nother episode. So when chickens are eating healthier chicken food than like insects and seeds and what's naturally in the pasture, those yolks are healthier and they have less saturated fat. And so egg yolks are not necessarily good for your arteries if they have unhealthy saturated fat in there. So you could overdo it. I generally don't like people eating more than a dozen eggs a week.
That's a lot of eggs. I can't even come close to that. I mean, I have probably four eggs on the weekend and two during the week. So that, gosh, half a dozen for me. You're giving me a lot of leniency. I might have to have a few more eggs. But it's
What I
certainly
like
making
about
Douglas
eggs, they
happy.
don't, whole eggs, they're delicious. They're a natural breakfast option when most Americans are eating a very starchy breakfast. So eggs, are much better. And if you want some yolk in there, then that's your choice. So, yeah, a dozen a week would be plenty. I wouldn't eat more than that.
Fantastic. Thank you so much, Dr. Dansinger. We really appreciate you. If you want to subscribe to Dr. Dansinger's YouTube channel to learn more, we're on just about every week. So you don't want to miss an episode because we learned so much. And you can come back every single week with different questions. And we do have different topics as well, but Dr. Dansinger tries his best to answer whatever questions you might have about your diet, especially when it comes to diabetes reversal. So to subscribe to his channel, make sure you go to youtube.com/the Michael Dansinger MD, and you can subscribe to his channel. And also, Dr. Dansinger, you have two different websites that they can go to as well.
Yeah, diabetesreversal.com or Michael Dansinger